I guess we're on a different platform, right?
Yes, it's not the GoToMeeting platform.
Oh, okay. This morning, Board of Public Works, the live streaming wasn't working. The platform that they used for that wasn't up and running nationally, or there were some problems nationally, so it created a challenge. So good to see that this meeting, we chose a different platform. Use and everything's going well. Guess we're ready to start. I guess you all were waiting on me. So like I said, good afternoon, everyone. And it's a pleasure to have this quarterly meeting of the Interagency Heroin and Opioid Coordinating Council. It's the final meeting of 2021. I understand that the council's annual report is in preparation and should be published early in 2022. Still strange for me to say 2022, but that's another story. Of course, the work of this council and everyone who's involved in trying to address the challenge of heroin and opioid epidemic that has been taking place long before COVID in this country, in our state, is vital work that must continue. And of course, the holidays for many people can be a trigger and be an additional challenge for those who are in recovery or who are suffering from substance use disorder. And just want to make sure that people understand, and those who may be listening out there, if you know someone or you yourself is having challenges, there are resources available. There is help a phone call away, 24 hours a day, 7 days a week at Maryland 211. Also, the Maryland 211 program has launched MD Hope, which is a new opioid texting program that connects individuals, family members, friends, and professionals with essential opioid-related resources, including treatment providers, safe drug disposal, and as well as just messages of support. And that you're able to access that by texting M-D Hope to 898-211. That's MD-Hope, sending it to 898-211 to sign up. Just very quickly, most people know that we are still facing the COVID-19 pandemic. And while about 90% of Marylanders, adults 18 and above, have been vaccinated, there's still a lot of people who haven't. The best way to protect ourselves and our families and loved ones and community is by getting vaccinated. And if you have been vaccinated and you receive the Pfizer or Moderna—
Recording in progress.
Oh, I thought it already was. But if you've received the Moderna or the Pfizer vaccine, and it's been 6 months since your last regimen, going through that regimen, we strongly encourage you to get a booster shot. And if it's been 2 months since the Johnson & Johnson, that you should get a booster shot as well. Currently, 16 and 17-year-olds are eligible for boosters for the Pfizer vaccine if they're more than 6 months since their last vaccine. We're in a race against the variants, and we are challenged by the most recent one, the Omicron variant. And while it is challenging, it is much more infectious. It transmits much easier. And so it's a particular challenge for those who are at greatest risk, those who have underlying health conditions, high blood pressure, obesity, diabetes, immunocompromised systems. They are at extremely high risk of additional, I should say, more severe symptoms. So with that, I'd like to go around our tables for a quick roll call. And when your name is either called out, or rather than me calling it out, let's have everyone just go around the table. Why don't we start with Russ, who's coming in remotely.
Russ Strickland, the Acting Secretary for the Maryland Department of Emergency Management. Thank you.
And we'll go left to right.
Robert Green, Secretary of the Department of Public Safety and Correctional Services.
Gray Barton, Maryland Judiciary Office of Problem Solving Courts.
Jerry Jones, Secretary of Maryland Department of State Police.
Ted Delbert, Executive Director for the Maryland Institute of Emergency Medical Services System.
Aaliyah Jones, Deputy Secretary of Behavioral Health Administration.
I'll skip me.
Everybody knows who you are.
Okay.
Robin Ricard, Executive Director of the Opioid Operational Command Center.
Jay Cleary, Chief of Staff, Department of Juvenile Services.
Yesham Kerman, Chief of Staff, Governor's Office of Crime Prevention, Youth and Victim Services.
Reggie Burke from the Maryland State Department of Education, representing State Superintendent Mohammed Chaudhry.
Thank you. Okay, thank you. Now, I want to ask if everyone has had a chance to read the minutes, if they have any concerns, edits, before asking if there's a motion to approve. Concerns from anyone with regard to the minutes?
I'd like to make a motion to approve the minutes.
We have a second?
Second.
All in favor, say aye.
Aye.
All right, and that's approved. Okay, so we'll have some presentations. I think the first one is from Executive Director Ricard on an update from the Opioid Operational Command Center.
Okay, thank you. Good afternoon, everybody, and thank you, Lieutenant Governor, and thank you to all the members of IACC. It's always a pleasure to be with you all. And today I'm just going to share a few important updates from the Opioid Operational Command Center, which will include a recap of our progress updating the Interagency Opioid Coordination Plan for 2022. The OOCC recently began the process of collecting input for next year's plan from our state and local partners, and we intend to release the updated plan early next year once our review process is complete. I also want to provide a summary of the input that we have gotten thus far through the Maryland Stop Overdose Strategy Regional Town Hall Series. To date, we've had 5 town halls throughout the state, and we have one more session planned for next week in Annapolis before the end of the year. And the purpose of these series is to gather feedback from Maryland's opioid crisis response efforts directly from community members. We've received a lot of really good, valuable feedback from a diverse set of communities and stakeholders, and we will also be using this feedback to help inform our process for updating the 22 coordination plan. And lastly, before diving into those updates, I just want to mention that the OOCC is currently in the process of drafting our report for the 3rd calendar quarter of 2021. And as always, the report will include an overview of the most recent data related to overdose trends in Maryland. And although this data is not available to share today, the OOCC will be releasing our report early next year, and we'll have some additional exciting updates to share at that time as well. So stay tuned. So with that, we can jump to the first update that I have for you today regarding the progress that we've had in updating our interagency opioid coordination plan. The coordination plan serves as Maryland's strategic framework for guiding the state's opioid crisis response efforts. The document is focused on advancing Governor Hogan's 3 policy priorities of prevention and education, treatment and recovery, and enforcement and public safety. The plan identifies key goals, strategies, and tactics to address each of these pillars. And every year, the OOCC works with our state and local partners, as well as representatives from private community-based organizations to review and update the plan based on the evolving needs and priorities around the state. Next year's coordination plan will incorporate several new elements that will help make it even more comprehensive. New considerations in our plan for 2022 will include the findings from the Data-Informed Overdose Risk Mitigation Initiative, or DORM. The goal of DORM is to link data from overdose victims across various public health and public safety sources. And linking these data sets enables us to identify common overdose risk factors, which in turn can help us direct resources to the most critical areas and to better calibrate programs and policies that can help reduce overdose mortality. The project was covered in detail at the last IACC meeting by Marianne Gibson from our office and Michael Bayer with BHA Behavioral Health Administration. So if you have any questions about the initiative, please reach out to either of them for additional information. And as I mentioned, the plan will also incorporate some the community feedback collected from the Maryland SOS Town Hall series, and I'll address that a little bit later on. And lastly, the plan will take into account the goals of the statewide Integrated Health Improvement Strategy, or SIHIS. SIHIS is an initiative or an agreement between the state of Maryland and the Centers for Medicare and Medicaid Innovation. SIHIS seeks to align statewide efforts across 3 domains with the goal of improving health outcome for Marylanders. The 3 domains are hospital quality, care transformation across the system, and total population health. Reducing opioid-related mortality was identified as one of the state's 3 total population health priorities, and the other 2 are diabetes and maternal and childhood health. This slide will illustrate our process for updating the coordination plan. Taken together, these considerations ensure that Maryland's opioid strategy is as thorough and comprehensive as it possibly can. Thus far, the OOCC has conducted 2 sessions to begin collecting all the input, one for partners for state agencies and the other for partners with local jurisdictions. The sessions focused on evaluating the broader goals outlined in the plan, and each session featured a collaborative SWOT analysis to assess the strengths, weaknesses, opportunities, and threats for our opioid crisis response framework. We also conducted breakout sessions to analyze each of the goals associated with the 3 pillars to determine if any updates were needed and if the goals were still relevant. And these sessions represent the beginning of the process to update the plan. We'll be holding additional sessions to examine specific strategies and tactics associated with each goal and to identify any new programs or initiatives as we move forward. We'll then synthesize the input that we've received and begin drafting the updated plan early next year. And I believe our next, we'll be scheduling those in January. And that concludes the overview of the coordination plan. And if you'd like to review the plan for last year, you can find it on our website before it's too late, .maryland.gov, or you can also reach out to Marilyn Gibson with any questions about the update for our plan for 2022. And next up, just briefly, I want to give you an update on our ongoing public engagement campaign, the Maryland Stop Overdose Strategy Regional Town Hall Series. Maryland SOS is a multi-pronged campaign that leverages new and existing funding sources and partnerships to address the rise in overdose deaths observed during the COVID-19 pandemic. And a central component of this campaign involves our town halls. When we go to the town halls, we gather feedback directly from community members across the state. And one reason for this, as I mentioned, is to inform the coordination plan. We also want to consider the voices of all Maryland communities to help guide how the state will use the funds that it receives from legal settlements with prescription opioid makers and distributors. And during our town halls, we're also sharing information regarding the Opioid Restitution Fund. The Opioid Restitution Fund, or another acronym, ORF, was established in 2019 to manage all money that Maryland receives from prescription opioid-related settlements. The ORF outlines various requirements that ensure that any money that we receive is used to support proven strategies and programs. Additionally, it makes sure that our leaders work together to use funding in ways that work for everyone. It requires the governor to create a plan to use settlement funds with specific goals and performance indicators. We must also submit a report annually to the General Assembly regarding the progress toward achieving those goals. And lastly, it requires the governor to consult annually with key stakeholders, such as experts in the field related to substance use disorder, members of the treatment and prevention communities, and community members who have been affected by the opioid crisis. And as I mentioned, the ORF may only be used for to support a select number of priority areas, which you can see listed here. I'm not going to read them all to you, but some of the most critical: improved treatment and recovery, peer programs, screening, brief intervention and referral to treatment, or SBIRT, increasing access to medications used to treat opioid use disorders such as buprenorphine and methadone, Maryland's Heroin Coordinator Program, and mobile crisis services, and school education programs. Many of these programs are already being implemented throughout the state at local levels, and we are very excited about the opportunity to expand them in the near future wherever possible. And our first town halls were held in Western Maryland and the Lower Eastern Shore, as you can see here. We then hosted two town halls in Baltimore City, followed by a session in Glen Burnie 2 weeks ago for Anne Arundel County. And our next session will be held next Tuesday, December 21st in Annapolis at the Pitt Moyer Recreation Center. We're also in the process of scheduling additional dates for the Upper Eastern Shore, Southern Maryland, and a statewide virtual event, which will take place next year. And real briefly, the next few slides are just going to summarize some of the common themes that we have been hearing from community members, because we want to hear what's working, what's not working at each of the sessions. And our first event was held at the Allegheny College of Maryland in Cumberland for the Western region of the state. We also had the pleasure of being joined by the Lieutenant Governor for our inaugural session. And during this town hall, and Dr. Jones as well, some of the major themes that we heard included the need for greater access to treatment in rural areas. Transportation is a big barrier to treatment, expanding recovery support services, and the need for additional youth prevention programming. Then our next session was at the Salisbury University in Wacomico County for the Lower Eastern Shore. And at that town hall, we heard some similar themes regarding the barriers to providing substance use programming in rural areas, such as transportation and lack of treatment bed availability. And another major concern we heard at that session was stigma and community pushback to naloxone distribution efforts. Other considerations: increasing support for peer programs, providing MOUD in correctional facilities, and increasing support for community-based organizations. And then our next two sessions were in Baltimore City. We ultimately decided to hold two sessions in the city, given the impact that the opioid crisis has had on Baltimore. We also wanted to capture potential differences and perspectives between communities and neighborhoods in the eastern and western areas of the city. Our first session was held at St. Bernardine Church in West Baltimore, and then our second session was held at the Orleans Street branch of the Enoch Pratt Free Library in East Baltimore. And despite holding two sessions, we ultimately heard a lot of similar concerns during both town halls. Some were common themes, such as increasing support for peer programs and specifically increasing peer compensation, increasing support for community-based organizations, increasing recovery services and associated support such as housing, increasing support for harm reduction services, reducing, again, stigma, improving community relations with law enforcement and the prevalence of fentanyl in the supply of illicit drugs, and increasing, again, access to medicated assisted treatment, MOUD. And then lastly, our most recent town hall was held in Anne Arundel County. The major themes we heard during those sessions were the need for reducing stigma, stronger prevention efforts in youth centers and schools, expanding recovery resources, addressing gaps in funding for treatment providers, increasing funding for harm reduction services, and increasing support for community-based organizations. And as you can see, community members across the state have identified many similar needs. Among the concerns we have heard the most are the need to combat stigma, addressing gaps in treatment services, and increasing support for peer programs, specifically addressing low pay or peer recovery specialist. There's also been some clear regional differences which highlight the continued importance of considering local needs when supporting programs and initiatives to address the opioid crisis across the state. And once the town halls have concluded, the OOCC will compile all the feedback that we receive, which we will share with the governor's office, with this team and our state and local partners. And we will also post detailed summaries for each session on our website. And that concludes my remarks.
Okay.
Oop, went a little too far. And as always, this is our contact information. You can reach out to us at any time.
You, Executive Director. Before we go to the next presentation, I'd like to go back around the room, and if our members can just state briefly what their organizations are doing in this area. And I know it varies based on, what your mission is, but if we can go back in terms of the challenges that you're seeing and how you're trying to address those challenges. So we'll continue left to right.
Yeah, very good. I'm Robert Green, Secretary of the Department of Public Safety and Correctional Services. I think one of the things you'll hear today from our Division of Parole and Probation is how we're making sure that every touch point we have with people that are under our care, our custody, our supervision, but that we have the ability to have naloxone available in the field to make sure that we're keeping people safe. And DPP, what they've done, I think is evidence of that across our community supervision programs and all of our touch points there, to include on the Division of Corrections side, our home detention units and our individuals that are engaging people in the community there. I think the other really important piece on the front end is the intake assessment and diagnostic kind of information we get from individuals that are coming in our system, and how we, if we're able to deflect people to treatment. As you know, Governor, we operate the Baltimore City Jail Complex, which creates that opportunity for us to look at diversion programs for individuals there. The big piece, again, another deep end of the pool for us is reentry. Individuals that are leaving our custody, planned reentry sequence going back into the various communities around the state, because we know that individuals, while there's some concentration in certain zip codes, are going back from mountain to shore. So trying to engage dedicated reentry resources and supportive services around substance abuse treatment in each local jurisdiction, because we know if we connect them there, their success, and the research tells us, is much greater. So very supportive of this work, and just always looking for a touch point. And the information I think you shared is really important as we engage each of our county and local providers and how we can do better, and a really robust substance use treatment contract that I'll be bringing before the Board of Public Works in the near future.
Gray Barden, again, Maryland Judiciary Office of Problem Solving Courts. So where the judiciary is working with problem solving courts, we've recently approved and they've taken in referrals in 2 new drug courts in Baltimore County, one in the circuit court, one in the district court. We also have plans for in various stages of planning in Baltimore County District Court Mental Health Court, Allegheny County District Court Mental Health Court, Charles County Circuit Court Adult Drug Court, and Queen Anne's County Adult Drug Court in the circuit court program. Those are in various stages of planning. And so we've pushed that. We realized, when the pandemic hit, the first 3 months when the courts were still open, but remotely, and we were not making the contacts that we have in our problem solving courts. We saw in those first 3 months a 200% increase in deaths in our participants in treatment courts compared to the same time period the year before. Obviously, that shows the direct correlation between the contacts that our participants have with the courts, with probation, with treatment, and the whole team, is that when that fell through, overdoses skyrocketed for this very volatile population. And so, again, we've taken measures to increase the ability to connect remotely with our participants with court hearings when we can. I know there's, treatment and probation is doing what they can remotely, but that was one of our biggest pushes over the last, I guess 20 months.
Good afternoon, Jerry Jones with State Police. We have a twofold mission with this piece. Obviously, we have, as first responders, we have an naloxone program that we have implemented throughout all 24 jurisdictions in Maryland. We have that going on, but on the law enforcement side of things, we certainly work it at all levels, at the street level, and trying to interdict supplies of opioids into Maryland before they get into the hands of potential users. So we take those investigations and try to make the most of those to get into drug trafficking organizations and bring those people to justice so we can eliminate that flow.
Thank you.
Ted Delbert, DMS, and in no particular order, I think that one of the things that we're particularly cognizant of is the way that the data collected by EMTs and paramedics in the field becomes a crucial part of the surveillance system to understand what the opioid epidemic is doing in Maryland on any given day. And we share that information with the OD map in real time and make sure that that information continues to flow. We've been particular advocates of EMS jurisdictions engaging in naloxone leave behind. We know that when EMTs and paramedics leave naloxone behind at a victim who they resuscitate but subsequently doesn't go to the hospital, that in that community, the likelihood that bystander naloxone is administered to somebody is exponentially higher. So a really good thing. And we've advocated and we're trying to get jurisdictions to link up with follow-up services. In some cases, the model really is the Stabilization Center in Baltimore, where people who are resuscitated and seem to have a use problem, but nothing else that's clinically overwhelming, they can go right to treatment. And there are a couple of models that are evolving in the state to do that.
Thank you, Dr. Elbridge.
So the Behavioral Health Administration probably does much too much, and I don't want to bore you. But I think big bucket item is that we oversee all the federal, the majority of the federal funding that comes to the state through our substance abuse block grant. So we provide direct funding to providers that are not funded or that do not provide fee-for-service services through Medicaid, in addition to the funding that we receive through the SOAR grant as well. We support a lot of the projects and programs that you all have already heard mentioned today. We provide the funding for the MOUD projects in the jails currently that are there right now, and the TA support to those programs as well. We drive and are driving the quality outcomes for substance abuse programs in the state, including in our OTPs. We have an OTP best practices document that we hope to publish in the very near future. We are supporting the opioid overdose prevention strategy. Actually, we developed the opioid overdose prevention strategy team that has been focused on trying to minimize the impact of the COVID pandemic on opioid overdoses in the state. And I do think that was effective because even though everybody knows the horrible problem we have with opioids in the state, we didn't have the same increase in opioid overdose rates that others did who did not have the same intensity of the opioid epidemic that we have been experiencing in Maryland. So that has allowed us to do a better job coordinating very regularly across the state with all the different jurisdictions and all the state agencies. We have been supportive of the peer workforce and growing the peer workforce, providing funding for the peer workforce, but also growing the non-peer workforce for substance abuse services and behavioral health services in general. And then I also chair the opioid death disparity team or task force that is looking at trying to close the gap in opioid overdose death rates in the Black community that continue to plague Maryland and the nation as well with regards to where the growth in deaths is growing exponentially. So that's just some of the things that BHA does.
Good afternoon, Jay Cleary, Chief of Staff, Department of Juvenile Services. For our particular population that comes to us, there's always, whether they're admitted or committed to us through the courts, there's always an assessment for risks and needs for every youth. And that would also include substance use disorder. So those risk factors, even if they don't present those particular, they don't admit to having a substance use problem, we have various, screening tools that we use to make sure that we can kind of catch those risk factors and address them, obviously, if necessary, through treatment. As it relates to the opioid issue, for our youth that, one of the things that we're able to do, which is unique among juvenile justice agencies, is that for youth that are arrested and brought to us by law enforcement and they are under the influence, of opioids or other drugs, we are able to do a medically managed detox for all those youth. Typically, that has to be done in a hospital, but our chief medical director, who's a licensed pediatrician, she has worked with partners at DHS and gotten the appropriate steps and procedures involved to make sure that we can safely manage that detox for those youth and get them immediate services. So that's obviously just the first step. And then we would, of course, provide services and supports for that youth going forward for substance use disorder. So that's something that our chief medical director instituted years back when the opioid crisis started, and continues today. And we're able to do that today. And, I think that's something that can address, part of the issue, at least. I know there's many parts, but that's one thing that we can do to help. But thank you.
Hi, just to reintroduce myself, my name is Yeshua Karaman. I'm from the Governor's Office of Crime Prevention, Youth and Victim Services. And our agency works alongside our state partners and stakeholders, as well as the state agencies, closely working with state police, Department of Corrections, as well as our local chiefs and sheriffs within the counties and municipalities. We have our Heroin Coordinators program, which places coordinators throughout the state to work with the HIDA, which is our high intensity drug trafficking areas that are identified throughout the state. They collect data and make referrals to treatment. To date, we've had about 3,500 investigations with over 11,000 referrals in the state. Additionally, we have our MSIN units that work alongside law enforcement, and they work to identify these drug trafficking organizations to dismantle and to disrupt them. And we also have our law enforcement coordination programs. Specifically, an example of one would be our Handle with Care program, where law enforcement and coordinators are referring children to receive help within the school system when they're introduced into any situation that would be harmful for them. So it's the multi-pronged approach of having the youth, the victim, services, and law enforcement to work together.
Once again, I'm Reggie Burke from the Maryland State Department of Education. We continue to provide the prevention education programs throughout the state at all of our grade levels. One of our programs that's actually funded through VHA is our online teacher training program. We're excited to announce that we roll that out. There are 2 modules, an elementary module and our secondary. The elementary module has been up and running for a while now. We have a number of teachers in the elementary schools across the state who logged in and be able to, it really trains them how to teach substance abuse to their students, because we know many of our teachers, especially at the elementary school level, they may not have a health background, and so it provides them some support and guidance. The secondary module will be rolled out in about a week, so we're really excited about that as well. We also have the Maryland School Mental Health program, and through that initiative, we've been able to develop the mental health school response teams. And on that team, we have a psychologist. We just hired the director and their substance abuse counselors and mental health counselors to support the students across the state, because we do know the correlation between mental health and substance abuse.
Very good. Thank you. Secretary Green, would you like to introduce Banner?
Certainly, thank you. As I noted, Governor, one of our again, incredible programs through the Division of Parole and Probation is all of the elements of their supervision and how we try to assist people in the community. And under Director Danner's supervision, the department developed a program to make sure that naloxone is available to the agents in the field and how we implement that as again, we encounter people not only just in a supervision type of scenario, but encountering people and individuals in our community. And we have already had some life-saving incidences within our system. So to that end, I'd like to introduce Martha Dana, who's the director of the Department of Parole and Probation for the Department of Public Safety and Correctional Services. And she has brought one of our agents with her that she will introduce.
Good afternoon, everyone. I'm Martha Danner, Director of the Division of Parole and Probation. And with me today, I have Tia Brunson, who is the Administrator and our Overdose Response Training Coordinator for our division. Everyone, thank you for having us here today to talk about something that's so important to us all. Okay, so that's us. Director Tanner and myself.
Without masks.
Without a mask, yes. And I am an administrator, as she stated, and the coordinator for training for our complete staff for the ORP program, which is our overdose response program. So the mission of DPP, we know in order for us to remain a leader in corrections, community corrections, and law enforcement agencies, we support the tenets of JRA. And in order to do that, we create an effective criminal justice system that protects the public and also support for individuals that we serve. And how we do that is we engage individuals under our supervision with programs and services that address their unique criminogenic needs and their risks. And
Let me just say that JRA, Justice Reinvestment Act.
yeah, yes.
Okay, just for those who
Oh,
are
I'm sorry.
playing along at home. So.
I'm sorry, for JRA, Justice Reinvestment Act of 2016. And along with that, our vision includes to collaborate with community stakeholders. And in this initiative, our stakeholder is the Maryland Department of Health, MDH, and along with the Division of Parole and Probation, DPP. And before we get to the basic overview of what an overdose response program is, which most of you may know or may not know. So in March of 2017, Governor Larry Hogan signed an executive order that declared a state of emergency in response to the heroin, opioid, and fentanyl crisis that was ravaging in the state of Maryland and across this country. So this declaration from Governor Hogan activated the Governor's Emergency Management Authority and enabled increased and more rapid coordination and response to the opioid crisis across the state. And the importance of the executive order still holds true to this current climate. And this is where the collaboration with the Maryland Department of Health and the Division of Parole and Probation came to be, where we started to link and bridge the public health with public safety. And so we haven't gone through the stats. Well, I don't have stats to show, but I've reviewed the stats for the current Q2 for opioid-related intoxication deaths by place of occurrence in the state of Maryland. And that further supports those stats for Q2, which covers January to June of 2020 versus January to June of 2021. It further supports that there is still a need for a response to address the opioid crisis in the state of Maryland. Approximately half of the 24 counties reported slight reductions in the opioid-related deaths. However, Baltimore City and Washington County saw the highest increase, in Prince George's County and Howard County saw moderate increases, which tells us that our work is still very prevalent with the opioid crisis. And with that, I'll go into an overview of the overdose response program. So, overdose response program, which is ORP, is administered through the Center for Harm Reduction Services. And it means that it provides training for bystanders to administer naloxone in the event of an opioid overdose. The overdose response program was established by statute in 2014, and the regulations were most revised in 2019. And that revision provided a mechanism for naloxone to be dispensed outside of a healthcare setting. And that's what allowed entities to become authorized as ORPs to partner with a prescriber, and they serve a standing order, and then staff can be trained, and then you can dispense the naloxone. So on March 31st of 2021, the Maryland Division of Parole and Probation was authorized as an overdose response program in order to serve the community. And why the Division of Parole and Probation and the benefits? So when we became authorized as an overdose response program, we did this to increase the reach and acknowledging the need for risk reduction and affecting the survival of individuals diagnosed with substance use disorder. This cross-agency effort allows 36 community supervision offices in all 24 jurisdictions, that's 23 counties in Baltimore City, statewide, to serve as a social experience entity. And we are authorized to dispense naloxone to individuals most at risk of substance use disorder, to eliminate the stigma attached with receiving naloxone, and also meeting individuals where they are. A lot of individuals who are on supervision, some feel comfortable speaking with their community supervision agent as opposed to being given a prescription for naloxone and having to go to a pharmacy, having to, present themselves as someone having a substance use disorder. So we felt that this was the most important way to reach out to those most affected. And just a quick snapshot of DCP as an ORP. Staff training. So to date, we have trained 711 community supervision staff statewide, and that training is inclusive of all classifications, from intake reviewer to our director here. And staff are trained to recognize and respond in opioid overdose, the proper use and administration of naloxone. They're also trained on the proper rescue techniques and the importance of contacting emergency medical services in the care of an individual after administering the medication. Also, we have dispensed over 300 doses of naloxone to date, and that's through offices as well as community events. And one of the big ones that we participated in was National Night Out, that was here in Annapolis, and our agents were able to distribute naloxone kits during that time as well to individuals. And lastly, expansion efforts. So as Secretary Green has mentioned, we also expanded the reach by training home detention staff that are housed in our community supervision offices. And those officers provide naloxone to the individuals under their authority, as well as we have agents that are equipped with the kits during home verifications and community contacts. The poster that you see here, that poster is in all the field offices throughout the state. It's in English and in Spanish. It goes over the signs of an opioid overdose, as well as the steps to take to prevent an overdose with the naloxone kits. And lastly, DPP statewide harm reduction expansion dovetails into the National Governors Association's efforts to build the capacity for DPP to address opioid overdose risks and improve health and safety outcomes for individuals that are on community supervision. So Maryland, along with Virginia, Tennessee, and Alaska, were selected by the National Governors Association to participate in the state's workshop on improving outcomes for individuals with opioid use disorder that are on community supervision. And this workshop is an opportunity for Maryland to receive technical assistance and support in developing strategies to strengthen health and substance use treatment services for justice-involved populations on community supervision. And Director Dana will be able to go into more information with you and provide you with her vision and the desirable outcomes for DPP for this strategic action plan that they have developed.
So the Division of Parole and Probation, working with the Opioid Operational Command Center, the Government Affairs Interagency Center, and the Maryland Association for Treatment of Individuals with Opioid Disorders are all part of the work group for technical assistance from the National Governors Association. And we established 3 goals. One is to incorporate substance use disorder training for all DPP staff. We do have substance abuse training, but we wanted to enhance it for individuals with opioid disorders. The other goal is to kind of piggyback on what CNS is doing, that everybody that comes in for an intake will get a substance abuse assessment, whether it is a special condition or not, so we can ascertain if they have any needs for the treatment. And then our another goal we have is to establish communication with HINA to identify individuals that are under supervision that have experienced an overdose, fatal or non-fatal, and share that information so that we can provide services to the non-fatal overdose. Any questions?
I do have a question. In terms of your field staff that goes out, do they carry naloxone with them?
Yes, sir.
And if I may, Governor, we're really working to, thank Governor, to institutionalize this in everything we do. It's not an add-on now, so it's going to be in policy. It's a keep-on person. It's not something you're trained on. You leave in the glove compartment if you're on duty. It's a keep-on person. And really going that distance to kind of make sure that we're prepared, institutionalizing it in the training academies. So it's not an add-on to the curriculum. It's part of the curriculum in the academies that will live into the future of how we continue to evolve and be available to people. And I think the part that we don't run by, and I commend Ms. Dan and her team, is also the families of people that that are within our caseload. That is just this other significant multiplier of populations when they come to us and their children, or they have an issue with children, spouse or otherwise, how we can refer and connect. And even if it is for that moment in time, wherever we can make a difference. But it's just institutionalizing it from beginning to end in policy practice in the very core of what we do. We save lives, and I commend this group for just some incredible stories.
And then before even reaching your office, you identify individuals because they're screened when they come in that have a history of substance use and possible addiction. And so when they come out, there's this understanding that this person is at risk.
Right. Yes, sir. And the connection to the program that's seamless. And I think the last thing we talked about in the last meeting that we're doing is we're creating data. It gives us information, it gives us insights, and working in some of the data collection models now that are giving us more and more insightful information and where, when, and how to connect people. So that's another piece I failed to mention, but we're really excited about being involved in that.
Other questions? Oh, yes.
Actually more just a comment and a statement of appreciation, Secretary Green, for your leadership, because I think that this project, when I learned about it through Aaron Russell, through our opioid overdose prevention strategy team meeting, I said, this is an excellent initiative. So thoughtful and so impactful, and able to help and bringing the parole and probation agents into the healthcare space, in all honesty, and because addiction is a healthcare condition. And so I just think that this is and I don't know if other states are doing this or not, but to me, this is innovative and quite impactful. And I appreciate your leadership for supporting it, and also for making sure that those who are under you are able to see addiction for what it is, as something that you can do something about. And it's not bad people, but it's a bad problem. that can be intervened and people's lives can be saved. So thank you for your leadership and thank you all for implementing this project and this program.
Thank you.
Thank you very much. Okay. All right. I don't know if there's any other, comments or questions or concerns anyone wants to ask. I forgot that Russ is out there and everyone was going around the table. Russ, if you want to take a moment and talk about what you're doing at the Department of Maryland Emergency Management.
Yes, sir, I would. Thank you. And I appreciate you coming back to me. We do continue to work with and support our local emergency managers in their role with the opiate intervention teams. And with that, we have our liaison people who work directly with the appointed local emergency managers and assisting with that in some of the counties. And then additionally, the Opioid Operations Command Center reports out monthly when we have a conference call every month with our local emergency managers. So we're staying tuned and supportive to the locals with anything they need and serve as a conduit, as a convener if they need that type of assistance. And then obviously a liaison role with the Opioid Operations Command Center. So thank you for remembering me out here in virtual.
Thank you. Well, any other comments or questions or statements? Well, I think we're coming to an end of our At Least Prepared program. So I want to thank everyone for being here and thank our presenters, of course, both from the Opioid Operation Command Center, as well as Public Safety and Corrections, Office of Parole and Probation, or Department of Parole and Probation. Thank you again, and those who were here in person, as well as those out there in the virtual world. Happy holidays, everyone. Please stay safe. Get those vaccines or boosters if you haven't gotten it. And we'll see you in the new year. Thank you.
Great, thank you.